All right, we're going to get started with our next speaker. I'll introduce Dr. Peter Bailerstedt from Barenbrug, defining sustainability in an era of suboptimal metabolic health.
Thank you. And sorry for giving you all that to get through. Bailerstedt from Barenbrug. Now for something completely different. Well, not exactly completely. My name is Peter Bailerstedt. I work for a seed company called Barenbrug. I have the role of promoting ruminant animal agriculture, forage agriculture globally across the country. I also advocate for the role of animal products in human nutrition and flourishing. And I've been given the name Don Pedro, the sodfather of the Ruminati. And the Ruminati are this growing group of people. Okay, we have dozens of people who belong to this group that understand the metabolic health really well. And then we have people who come in who understand the forage or the range or the animal science well. And I'm trying to build bridges and get us all talking with each other. And so my job here today is to kind of introduce the metabolic health space to you, because I'm going to take it for granted that we understand that grasslands are fundamental to soil health, to food systems, to human flourishing. That we understand that this idea that somehow producing animal source food and consuming it is not antithetical to sustainable development. By the way, all of the citations are available. I've published them this morning on my social media accounts, and I'm happy to email. So this I'm going to take as a given for this audience. Sustainable food systems require livestock. If that's controversial here, I've misjudged the audience. But we're having these conversations about sustainable food systems. And yet, my perception is for far too many people involved in these conversations, they're singularly focused on one of these aspects, environment. And they don't take sufficient weight of the other sub-themes under environment, let alone look at societal or economic factors. And they're certainly not looking at whole systems. They tend to be myopically focused on one factor. And that factor is not what they understand it to be. So that's we can have a conversation about GWP star versus GWP 100. But again, I'm going to assume that I don't need to go there. My purpose today is to suggest that we have not yet brought in to the sustainability space the conversation about chronic disease and the costs of chronic disease and the interaction between diet and chronic disease. So let's start by understanding that globally, deaths from the leading infectious and chronic diseases far outweigh any infectious diseases. Okay, sometimes we have a different perspective on this. And so we need to get that kind of information out there. And that's global information. Cardiovascular by far, cancer next, chronic respiratory diseases, diabetes is actually more than malaria, about what tuberculosis, so this is the ground that we're looking at. But let's look at the United States. Over half of adult Americans are either diabetic or pre-diabetic. 60% of adult Americans have one or more chronic illnesses. Only 12% of adult Americans exhibit optimal metabolic health, and that's even if they are, quote, normal weight. We've been driving toward really bad metrics, and we need to get that message better understood. The total cost of chronic disease due to obesity and overweight was $1.72 trillion at the point of this estimate, 9.3% of GDP. All of farm gate value is like 1. The entire food industry is like 5. And we have yet to accurately bring this in, or if we do bring it into conversations, it comes with some conventional wisdom. And we'll get into that. But don't fall for the myth, because this is one of the many myths out there, that this is the result of plagues of prosperity. That's a phrase you might have heard. Or affluenza is another one. Somehow being prosperous, we pay for that sin through these diseases. Well, it's not true. It never has been true. These diseases always associate with poverty. We've got 150 years of that data. We just don't pay attention to it. 4 out of 5 chronic disease deaths are in low and middle income countries. And then we've got, as I say, about a century and a half worth of data of looking at what happens to people when they undergo what's called dietary transitions. For whatever reason, we take people off of whatever they were eating, wherever they were existing, and we feed them highly processed, refined carbohydrates. And within that generation, we see virtually every modern chronic disease show up. Can't call them modern when they're showing up a century and a half ago, but we still try. And since we're down here in the Southwest, let's also acknowledge the Pima. The Pima, as a people, exhibit the highest recorded rate of diabetes. So I want to add into the conversation about sustainability some other factors. Like I'd like to look at what is the environmental footprint of healthcare? What are the ecosystem services of our livestock? Well, let's just say our ruminant animal livestock systems, including public health, properly understood. Social, it's not just quantity, it's quality of diet that's important. Personal health and public health. What's the societal impact of having 6 out of 10 adult Americans having 1 or more chronic illnesses? What's the social impact of shortened lifespan? And healthcare costs, economics. So that's just one idea. So again, I say we've got this conversation space contaminated with some ideas. So we have this idea that the dietary guidelines is what's going to tell us how to eat a healthy diet, right? Except that the dietary guidelines is not intended to be used to treat disease. It says so. And this is what they said in 2015, and they haven't changed it for 2020. So one could say that the dietary guidelines are not intended for the majority of adult Americans. And yet it drives policy in many, many ways, and if you're not aware of that, we can talk about it. Dietary guidelines is not intended to contain clinical guidelines for treating chronic diseases. This is from the 2020 to 2025 guidelines. So this will be in place for the next 3 years. And yet, we should understand that in terms of energy, isocaloric quantities of energy from plant source and animal source foods are not isometabolic when feeding humans, right? Energy coming from plants comes from sugar and starch. Energy coming from animal source foods comes from fat. Fat does not have the same metabolic effect, calorie for calorie, on a human being as carbohydrates do. Similarly, isometric amounts of protein and minerals don't have the same metabolic effect on human beings. And here's one that just makes us, our understood requirement for vitamins is completely dependent on the nature of the diet, such that the more carbohydrate in the diet, the higher our vitamin requirement. And yet we treat it as if it's a static amount. None of those 3 things are taken into account when the conventional wisdom regarding healthy diet, regarding sustainable food systems comes into play, by my understanding. Malnutrition today looks a little different than it did when I was a young man. 800 million still suffer caloric deficit. 2.2 billion are overweight or obese. Undernutrition, though, is not synonymous with caloric deficit. It's possible to be overfed yet undernourished. In fact, being undernourished may drive consumptive behavior, and that's something that we could talk about. Protein energy malnutrition is by far the most lethal form of malnutrition. Children are its most visible victims. Globally, under 5, over half of children under 5 years old globally are deficient in micronutrients, vital for healthy development. These are nutrients best or solely sourced from animal-sourced foods. Nearly a quarter of those children are stunted. This is not only in stature, this is cognitive development. It's been estimated that that burden of stunted cognitive development in sub-Saharan Africa is an 11% GDP drag on their economic development. And that's from a lack of animal-sourced food in their diet. 7% are wasted. That's low weight to height ratio. 6% are overweight at the same time. We must understand that obesity is not a driver of the chronic illnesses. Obesity is, in fact, a manifestation of those metabolic/chronic diseases. This is a paper that came out, and people should have been familiar with this. A quote from an unhealthy diets pose a greater risk to morbidity and mortality than does unsafe sex and alcohol, drug, and tobacco use combined. Okay. Learn to ask the next question, which is, what's your definition of unhealthy diet? We'll get to that in just a moment. Okay? But then there's the thing about a global transformation of the food system is urgently needed. That should scare the hell out of everyone. Because these people don't understand food systems. They have vested interests in food systems. They're not sincere players in this conversation. Here's another version of this out of the same shop. Suboptimal diet is responsible for more deaths than any other risk factors globally. Okay, so far we agree. Non-optimal intake of sodium, whole grains, fruits, vegetables, and nuts were the leading risk factors. Really? I may have missed this. It's been a while since I had monogastric nutrition, but when did fiber become an essential nutrient in a monogastric diet? If you don't know that story, that's an interesting one to pay attention to. But this is their chart. It's interesting. Down here at the bottom is a diet high in red meat. Up at the top is a diet high in sodium. Sorry about that. I knew I was going to do that. One of the culprits down here, diets high in sugar-sweetened beverages. That's making me call out male bovine fecal matter here. Especially when you've got diets low in fruits, and this is cardiovascular disease, type 2 diabetes. Well, there are researchers who are now saying cardiovascular disease begins in the liver with insulin resistance. So all they have to drive this is nutritional epidemiology of chronic disease. That's the discipline upon which all this food policy is based. And it's the weakest of the activities. The good news is that there is solid science looking at hyperinsulinemia and insulin resistance as being at least an aggravating, if not causal factor in virtually every chronic illness that we can think of, such that Alzheimer's disease is being referred to as type 3 diabetes. I just mentioned heart disease. Leading cause of infertility in women is PCOS. People dealing with rectifying hyperinsulinemia and insulin resistance in women caution their patients that if they don't want to become pregnant, they should make sure that they're on contraceptive before they begin the therapy, because that reverses so quickly. And yet we have women who are undergoing a lot of personal and pain to try to rectify that problem in their lives. But this is a paper that just came out the beginning of December. Diets with higher insulinemic potential are associated with increased risk of overall and cardiovascular disease-specific mortality. Let me translate. Any diet that raises your insulin and keeps it there is associated with a higher risk of heart disease and all-cause dying of any reason. Quick review. What raises insulin in the diet? Which of the three? Fat, carbohydrate, protein. Carbohydrate. Protein will nudge it, but it will also increase glucagon, so keep that ratio pretty good. So it's the carbohydrate, and we've known this for decades. It's just been really inconvenient when we've been telling people you need to eat less fat. You've got to get your energy from somewhere. Here's data represented from a study, 1 year in, a new healthcare model. Thank you. And basically, the thing to mention, anything in blue represents an improvement. 1 year in, this is the medication reduction in a group of diagnosed type 2 diabetics at baseline. What is the healthcare, what is the environmental footprint of diabetes? It's been estimated, one estimate was, that if the average type 2 diabetic adult in America could eliminate their medication use, they would reduce their carbon footprint 29% more than if they went from a high meat to a vegan diet. Just this is now 2-year data being published. You know, the reduction versus standard of care. This is the continuous care intervention, usual care. Type 2 diabetes is not an incurable disease. It need not be progressive. Drug-free remission of type 2 diabetes is a thing well established in the literature, and yet it's not accepted within this conversation space. And diets that produce this are diets that are restricted in carbohydrate, which means that you're going to have more than recommended amounts of animal source foods and fat, maybe from plants. You can tailor it to suit, okay? Now I'm going to get a little personal. Are you part of the 88 or are you part of the 12? I mentioned that thing before about how only 12% of adult Americans exhibit optimal metabolic health. So according to this study, if you have abdominal obesity, elevated serum triglycerides, low HDL cholesterol, elevated blood pressure, or elevated fasting blood glucose, or an A1C above 5.7, and those two are not the same thing, or if you're taking medication for any of those, you do not exhibit optimal metabolic health. And yet we have an effective lifestyle intervention that we could be educating people about. We could be introducing this audience to the metabolic health practitioners. We could be putting together those kinds of communities, and I'm here to do whatever I can to help. So let's build some bridges. We need multidisciplinary investigations about what constitutes a healthy diet for the metabolically well and ill. Maybe at some point somebody who's been metabolically ill can eat like somebody who's never been. We don't know that yet. But there are people who, like the smoker that smokes all his life and never gets cancer. Those people exist. So, okay. The vital role that animal source foods play in human development and health, the causes of chronic disease, the essential role ruminant animal agriculture plays in sustainable food systems. We need a science-based assessment of environmental, social, and economic impacts of the burden of chronic disease as well as animal source food production, especially in a landscape that, just as I've laid out, they may be key to metabolic health, and they're certainly key to proper human development. And we need a fresh perspective and approach towards communicating this information to the public. We can't be just talking to ourselves. There's not enough of us. There's far more, I hate the us and them, but you get what I'm saying. Okay, so one thing that I'll put in a shameless plug for is the upcoming, it is next May, not this coming, but next year, the International Grasslands Congress in Northern Kentucky, Grasslands for Soil, Animal, and Human Health. There are already call for papers out. Information's available. Dr. Smith is sitting here. He can give more information. There's a booth up in the hall. Some resources I tell people about all the time. Animal Frontiers, this specific issue on the topic of foods of animal origin, a prescription for global health. There's a website, dietdoctor.com. I recommend. I have no financial interest in it. The Clear Center, Dr. Mittlerner from UC Davis. Animal source foods in ethical, sustainable, and healthy diets. It's a dynamic white paper. There's over 24 scientists contributing to this on a real frequent basis. It's very current. No charge for that. Society of Metabolic Health Practitioners. They have a locator service on that, and they also have a clinical guidelines so that people can get accredited now as a physician for this Society of Metabolic Health Practitioner. And then you can see their literature review on using therapeutic carbohydrate reduction for treatment of various conditions. And it's meant to guide professionals in it, but it's a great literature set for us. You want to spend some money and buy some books. I'm sorry, I know I'm running long. Gary Taub's The Case Against Sugar, The Case for Keto. Nina Teicholz's The Big Fat Surprise, Why Butter, Meat, and Cheese Belong in a Healthy Diet. And then Dr. Benjamin Bickman, recently, his book, Why We Get Sick, is entirely devoted to hyperinsulinemia chronically and insulin resistance and its role in chronic diseases. So I want to thank you for coming. Thank you for supporting the Society for Range Management. My social media accounts, I'm available. If you find another Ballerstedt out there, let me know because he's probably kin, but you can find me at peter.ballerstedt@gmail.com or on any of the social media platforms. At least for a while, I'm still on the platforms.